Thank you very much. We're going to have just a little bit of a change in the agenda. I wanted to recognize Secretary Diana Dooley, who has arrived, and I know we have started with the first item in this section, but I would like to ask the director and the assistant directors to make room so that we can move ahead to the presentation by the secretary, and I'd like to welcome her. Thank you so much for being with us, and thank you to the audience as we move the agenda around just slightly. We will go back to the other items momentarily. So obviously we've been discussing some of the challenges facing the state developmental centers this morning, and we will go back to some of the additional items. I want to thank the secretary. She's to be commended for taking on the very difficult task, an important task, working diligently to find common ground, to work with all of the stakeholders in this process. We want to thank you for that. Welcome you today to the committee hearing as well. Ask you to present the findings of the report that has recently been completed, and of course ask you to respond to some of the questions in the agenda as well. And we just want to thank you for being with us, and without any further ado, please proceed and welcome.
Thank you very much, Senator. I appreciate the opportunity to be here, and I certainly don't want to displace the people that are here that know far more than I and will continue to engage with you as partners to assisting this particular population. A year ago, I pulled together a group that I called the Future of the Developmental Centers Task Force. And I did that because over the first 2 years here, it became very apparent much of what the status quo at that point had been established. Lanterman was already in the process of closure. Agnes had been completed. And Agnew's closure was really different than the other closures previously at Camarillo and Stockton, where the residents were really, it was more a consolidation where the residents moved from one center to another. But in Agnews, there was a real fundamental change where the focus was on moving residents to the community, and I think there were 20 or so who actually relocated to another developmental center. So as I began to engage and listen, and of course as secretary, a lot of people come and want to meet with me, and so I had lots of meetings, and it became very apparent, as it was to you, and I was hearing from our colleagues in the legislature, that there was a wide chasm, the combination of the history, the development of regional alternatives, the disproportionate number of people who are served in the community versus those who are served in the state residential facilities, the really devastating effect of the recession and the impact on the state budget that had fallen to many of the service providers that serve this population, all came together in a situation that felt very dichotomous. People were on one side or the other, and these two sides were close them now or keep them open forever. And neither of those options seemed appropriate. So I invited about 20 people to come together and help work with me to determine what would the future look like for the developmental centers. And of course that engages the entire Lanterman Act community. After I suggested this, I came to the legislature, was invited here a year ago. The legislature incorporated that task force work in trailer bill language to assure the partnership with you that we would continue to do what we had set out to do. And our goal was to have a report by November. We slipped by 30 days, but the report was out in December. And the work that we did together from the beginning, from the invitation that I made to the people to participate in the first meeting that we had as we came together, was to put the beneficiaries, the consumers, the people. They're different words, but the people who live in these centers at the heart of our discussion. And so the focus was around what is the future for these people, not just the future of the centers or the future of the staff or the future of the regional centers, but what do the people who live there now need as we go forward. And so the first work that we did was identify who these people are, and the group themselves, we met formally in public and took public comment at all of our public meetings, but we had work groups in between the public meetings, and virtually all of the members worked in the work groups. And we had parents, and we had consumers themselves, and we had regional centers, and we had service providers in the community, a broad cross-section of representatives. Disability Rights California participated with us. And they came together with a recognition that there were three kinds of needs that the people who live in the centers have. There were complex medical needs, and there were complex behavioral needs, and there were people who were in the centers because they had engaged in some way with the criminal justice system. The next work we did was identify what are the services that those three groups of people need, and how are those services met in the developmental centers, and how are those services met in the communities. And in that process, we coalesced around a recognition that there would be some people who would need some state services, that and we started with those who are engaged in some way with the criminal justice system, that the people in the community, everyone recognized there weren't community resources that could accommodate those needs. There was general agreement that those with complex medical needs were more likely able to live in the community, and we looked a lot at the people who had very similar needs who are being served in the community setting. And then the complex behavioral needs in between recognized that there was some recognition that some people with very complex behavioral needs have tried and have not been successful in the community, and we may need some kind of transition or crisis or perhaps permanent. We didn't settle on what they actually would need, but we recognized these areas of needs. And that came together then in a series of recommendations that were included in the report. And the work that we are continuing to do is around three categories of follow-up, if you will. Again, starting with the residents who live in the centers now, what are their individual plans? Each resident of the facilities has a personal plan for their care. Each one of those people is also served by a regional center in the area. So looking at each person and determining what they need and how they can be served is the first body of work that will follow up from the task force recommendations. The second body of work is what can we do in the area of the resources that we have, both physical and personnel in the centers. We have many people who have dedicated their lives. They have very specialized training for these very special need people. That, as you've heard before, the concentration of people with high-level needs are the people who are currently being served in the developmental centers. And so the people who are serving those needs, we want to preserve in some appropriate way to take advantage both of their expertise and in the investment that we've made in their skill sets, and what kind of facility structure would still be needed in the future to serve people either transitionally or perhaps the very aged, for example, that we may determine could not make a successful transition. So that's a body of work that will follow around the staffing and the physical plan. And then the third is what to do with the land, and you were just discussing that about Lanterman. Looking at the facilities that we have, there is a broad group of community interest in the Sonoma area, for example. Some of that land has already gone into a public lands use about a decade ago. There are interests in public-private partnerships for housing that could fit with the other two needs that we have. So what do we do with the property? How do we engage general services and the laws and rules that govern both before the property is designated surplus and after, in terms of what need could we put to it, or what could we do creatively to continue to meet the overall needs of this particular population. Concurrent with the work of the task force was the notice that I received in the fall that both the director and the chief deputy director of the department would be retiring at the end of the year. So I used the engagement process of the people who were assisting with the future of the developmental centers to get their input also on what was the future for the leadership. What do we need in the department? And through that process, identified two really excellent leaders that I'm very delighted to have with you here today, Santee Rogers and his long commitment over 40 years to this population, and John Doyle, who is one of the star leaders in state service. It was a very, I was very humbled that their willingness to come and take this baton and continue the work that we identified needed to be done in the task force and work with you in a process for change as we go forward. So that's sort of how we got started and what we did and where we are now. I'd be happy to answer any questions.
All right, thank you very much, Secretary Dooley. Senator Monning, do you have any questions? You can begin.
Thank you, Madam Chair. Well, I just want to thank the Secretary for your leadership. I think pulling together the task force was absolutely the right way to navigate the, as you said, a very polarized circumstance. And with the recruitment of new leadership, as you've framed it, will provide the leadership to move forward with the recommendations. I did notice that one of the recommendations was to establish another task force to address how to make the community system stronger. Maybe any update on implementation of that idea
Sure.
or recommendation?
Sure, that was interesting. That was a friendly amendment to the recommendation that we made. We recommended we made 5 recommendations, and as you can appreciate, we can't talk about the future of the developmental centers without talking about the community infrastructure. So it was woven throughout all of the discussions over the 6-7 months we spent together. But we were charged with the future of the developmental centers, and so we tried to create a parking lot for issues related to the challenges that exist in the community. As I said, the recession and the effect of the state budget was felt very significantly in the community, but we wanted to really focus on the developmental centers. So at the end, there was an agreement that that parking lot set of issues about community need would be the focus of some additional work. And so we will convene a group to do that, and it will be in large part, hopefully, some of the same people that came together with us last year. But again, I've been, John and Santee really only have been on board for less than a month, and I want to hear from them as they meet and engage with this same group of people and others about how we will go forward. But I am deeply committed to doing everything we can to move the recommendations of the task force forward, including evaluating the circumstances in the regional, in the community.
Well, I appreciate that sensitivity. One of the things that we will hear in the Budget Committee and that we hear regularly in the community is the question, to be successful in developing a strong community-based system, is provider rates and how we make it economically viable for providers to operate effective community-based homes. We know the evidence from consumers and residents who have made successful transitions, the many positives that are measured often in more subjective measurements of just quality of life. But to continue in those successes, the core becomes funding and budget. And so as we move forward, I know as a member of the governor's cabinet, as we look at these very tough budget questions, that these types of hearings are often the only interface opportunity we have as a budget committee and the state with residents, recipients, and providers. So I hope, as you've been a champion and leader on moving forward with the task force and your strong commitment to making these transitions successful, that you'll also join us in being an ally as a representative of the administration, making sure we have the resources to be successful.
I fully appreciate and understand, and my spreadsheet of spending requests is now up to about 8 pages, which is just a pittance of what you see. But the Health and Human Services Agency suffered the most dramatically under the budget constraints. There was over $2 billion taken out of the programs in this agency, across the agency. And as I said from the beginning, we weren't doing more with less, we were doing less with less. These cuts were significant and they were consequential and they affected real people's lives. And I am acutely aware of that every day as I hold this responsibility. And there is a very long list of buybacks, if you will, just to get to even, and even wasn't good enough. So I will work with you, as we all will, to allocate our still scarce resource for the highest and best use. And certainly there are a number of priorities in this area. You make the cuts where you are spending, and we spend more in this area, so we have suffered disproportionately in the lean times as well.
I know you're keenly aware and sensitized, and as you know, on the more macro level, as we look at finding a balanced budget, there's a strong objective of preserving maximum resources in rainy day funds or debt reduction. But for some people, it's a rainy day every day, despite the drought. And so that's the tension in our budget negotiations, and we look forward to you being a champion of equity and humanism in a final budget. So thank you.
I love all my children, Senator, and I've got a lot of them.
Thank you.
Thank you.
Thank you. Thank you, Senator Monning, and I couldn't have said it better, Senator Monning. I associate myself with those remarks as we deal with the many challenges we have going forward with the budget. It is a rainy day, despite the drought. Thank you. And Secretary Dooley, I also want to thank you for your great sensitivity and also taking on this very complex task, and really appreciate your hands-on work to ensure that everyone is involved in the process as we work together. And I especially appreciate your opening remarks about your concern, your utmost concern is the future of the people involved who we all serve. And I want to thank you for that. I do have a few questions that I would like to ask, and I am sure also your director, assistant directors, and deputy directors, not sure of all your titles yet, but can also jump in.
They're still getting used to them, too.
You're good people, we'll call them. Obviously, the budget trailer bill in 2012-13 required the submission of 2 documents, a master plan and the subsequent more detailed plan to meet the needs of developmental center residents. Can we anticipate the submission of a more detailed plan by the May revision?
I hope so. We're working double time to get our priorities and the supporting plans around those budget priorities ready for May, and whether we will have a plan that is that meets the description of that you've described in sufficient detail or not, I can't make a commitment to, but we certainly are moving in that direction, and we'll get it to you as soon as we can prepare it.
Okay, we appreciate that. We eagerly anticipate it, though, so we can make the very best decisions on behalf of all the individuals involved. Thank you very much. And how do you think existing resources such as the CPP funds can be utilized to the best of their opportunity to support the recommendations that we will see coming forward?
We are looking at that now as we are preparing for the May revision, and I have been getting deeper into the weeds than I ever expected I would need to know, but I am understanding that these funds, because of the way they are allocated, are never all used because they are committed to projects and then there are delays and the projects change. And so while I think the fund has been pretty constant at about $67 or $70 million, we haven't really operationalized that and used all of that resource. So my first priority, as I've begun to understand it, is to ask staff to come back with a proposal that will maximize the use of the funds that we already have. I know it came up in the work that we were doing with the task force that there were priorities around those funds that were focused on Lanterman, and they weren't all needed in Lanterman, and there was a sense that some of them could have been used in other areas. And so I have understood that. I'm inquiring about it and drilling down on that. So I'm hoping that we will have something ready to share with you about a more efficient utilization of the community placement funds.
Okay, thank you very much. Are you anticipating any statutory changes that will be necessary to help, fulfill the goals of the plan?
I don't know at this point how our plan will interface with the existing statute. My own personal view is wherever possible, we try to live within the authority that we have. If to do what we need to do requires a change, we will certainly make that presentation. I don't know at this point whether there is a need for a change to the statute.
Okay. Thank you very much. And we've been discussing this morning, there have been many discussions about maintaining the clinic and the specialized resources of the developmental centers. And they have been, in some cases, thwarted by concerns of maintaining federal funding. Yet to some degree, this issue was partially resolved with the limited continuation of the clinics post-closure at Agnews, for example. Is the agency or department exploring how this issue can be resolved to the benefit of community members who would, of course, benefit from these continued resources?
I spend as much time as they will give me with my federal partners, persuading them to make the maximum use of their resources for the benefit of our people in California. Certainly this is one of them. The extent to which we can get federal participation financially, we will get it, but whatever we need to do also will come into the budget priorities. So there are some services that have been required that we are providing with all general funds, even when we aren't successful. So we will do everything we can to maximize the federal funds, but I would see the continuation of clinic services and the broader work that we need to do resulting from the recommendations of the task force about what services should the state continue to provide and what is we struggled in the work about finding the right language for a can't say no or provider of last resort or the place where your loved one will be taken care of, and whether that's in a clinic setting or a residential setting, whether we get federal financial participation or not, or we have to support it with 100% general funds. I see the funding following the priorities, and that's what we're working toward establishing.
Thank you. An additional question with regard to the Fairview Developmental Center. As you know, it's a site of an existing public-private partnership that provides integrated services on existing state lands at Harbor Village. There was a second project at Fairview, and I believe it's been stalled due to some concerns that have been raised by the Department of General Services. Just wondering if DDS is working with the department to resolve the concerns and potentially any other projects similar to this might be able to move forward.
Yes. I could elaborate, but the simple answer is yes.
You're on it.
Good. I'm on it. It came to my attention in the task force that there was, I think it was called Shannon Mountain or Shannon Hill or something, yes. And I didn't know about it before we got into this public-private partnership conversation, so it's on the list.
Okay, great. Thank you very much. And let's see, the last question has already been asked by Senator Monning. Thank you very much with regard to the task force. So that's it for my questions. Are there any other items to add within that discussion? All right. Thank you very much for your presentation. We're very much looking forward to working with you, Madam Secretary, and thank you really for your great sensitive work and taking on these challenges head on. We very much appreciate it.
Thank you, Senators. It's my pleasure.
Thank you very much for being with us today. I did want to just add, in the discussion, of course, we were talking about making sure that we have information available by the time of May revision, and I just want to encourage the Department of Finance to bring forward the concerns of the legislature so that we can get the information that we need as well. Thank you very much. All right, with that, we are going to go back to where we were. And that takes us back to issue number 2. Let me just shuffle my papers here.